You know, we tend to think of advances in medicine as being a new drug, a new laser, something really high-tech and expensive. And we often have a hard time believing that the simple choices that we make in our lives each day, like what we eat, how we respond to stress, how much we exercise, and how much love and support we have, can make such a powerful difference, but they do. And in our research, we've used very high-tech, expensive, state-of-the-art measures to prove how powerful these simple and low-tech and low-cost and often ancient interventions can be. But since this is part of the mission of BSR is to talk about sustainability, I want to talk about that in a number of different ways. But to really emphasize that what's good for you is good for the planet. What's personally sustainable is globally sustainable. From a global warming standpoint, many people are surprised to know that livestock consumption causes more global warming than all forms of transportation combined. So simply stopping eating meat does more for you than driving a Prius does, and doing both is even better. Livestock is responsible for 18% of the world's total greenhouse gases, and in contrast, the entire global transportation system only accounts for 13% of greenhouse gas emissions. So these small things really can make a difference. Consuming meat causes acid rain for all the reasons we're talking about, an external acidic environment, but also causes your own internal environment. Your blood becomes more acidic, which promotes chronic inflammation, which is at the root of so many diseases, particularly heart disease, prostate, breast, and colon cancer. So from a health standpoint, you know, we've got this huge debate going on. As Mott's indicated, 18% of the GDP goes to what we call healthcare costs, but what Senator Harkin more appropriately calls sick care costs, because it turns out that 3/4 of the what's now $2.6 trillion in healthcare costs are from chronic conditions that we can largely prevent or even reverse simply by changing diet and lifestyle. You know, we have this big debate going on in Washington now. Republicans, many of whom are talking about dismantling Medicare. Democrats many of whom are talking about raising taxes, letting the deficit go up. Neither one of them are good options. But we have a third alternative. If we can address the underlying causes of why we get sick in the first place, we can make true health care, not just sick care, available at a fraction of the cost, and the only side effects are good ones. Feeling good is ultimately what enables people to make sustainable changes. So let's talk about that, because people think, you know, taking a pill is easy, changing lifestyle is difficult, nobody can do it. What enables people to make sustainable changes? It's not what I thought when I first started doing this work, because we generally try to scare people to change, but that's not sustainable. What's sustainable is fun and freedom and pleasure and love, because you want to feel good. If you feel good, you'll keep doing it. If it doesn't feel good, if it's fear-based, it won't do it. Fear is not a sustainable motivator, I think, in anything, but particularly in changing lifestyle. This goes all the way back to the first dietary intervention, which didn't work, when God said, don't eat the apple, and that was God talking. We're not going to do better than that. Because I've learned that even more than being healthy, people want to feel free and in control. And as soon as I tell somebody, eat this and don't eat that, and do this and don't do that, they immediately want to do the opposite. And it's not only not helpful, it's actually counterproductive. And if you tell a teenager that smoking is dangerous, that just makes it cool, like riding a motorcycle, like James Dean on a Harley. And so we have to work at a different level. If you go on a diet, diets are all about what you can't have and what you must do. And so if you go on a diet, sooner or later you're going to go off a diet, because diets are about being, you know, even the word diet makes you kind of cringe. It's all about being restrictive. And it turns out that, you know, the most toxic emotions for your health, and particularly your heart, are shame and guilt and anger and humiliation. And when you go on a diet, pretty soon you're going to feel that way, because nobody's perfect. And then you just, you know, people say to hell with it. So what I've done is to categorize foods, to say foods aren't good or bad, but some are healthier than others. And what matters most is your overall way of eating and living. So if you indulge yourself one day, eat healthier the next. When you're in your corporate world, to the degree that you can create an environment that has a sense of community, it's healing. I mean, the word healing comes from the root to make whole. And if you can meet an unmet need in business, you can create a great success. Even if you don't, if the need is as primal as this, even if it's not met all that well, you can create a multi-billion-dollar business. Look at the chat rooms in AOL. That's what made AOL so worth so much at the time. And then the lounges in Starbucks and Facebook, you know, is worth billions of dollars. That's not the most intimate of life experiences, but even a little bit of intimacy is more than many people have. And so if you can create a corporate culture that values these so-called soft things, love and intimacy and connection and community, it's good for your bottom line in all kinds of ways, not only in terms of reducing costs, in terms of productivity and giving people a sense that they're really happy to work there. That intimacy is healing. Anything that connects us is healing. And the perennial philosophy that Aldous Huxley called altruism, forgiveness, compassion, and love that you find in all spiritual traditions are really about things that connect us.
The question earlier was about the sort of poisonous environment. And that's why we put this on the agenda here today, because corporations can do a lot to create healthier environments. There is this Christakis, this researcher at Harvard who's done a lot of research on social networks and the power of networks.
Yes.
And I think the stat is that you're 47% more likely to lose weight if a friend near you loses weight.
That actually goes to 2 or 3 friends removed. So
the culture we can create in our companies is tremendous. Support systems, the food we serve. I can't tell you how many obesity seminars I went to in my prior career at various NIH events talking about the epidemic of obesity, and in the breaks they served muffins the size of footballs. And it's like, that didn't make any sense to me. So there's a lot we can do. I think on that note, let
me just add one thing. Yeah, that is that, to me, awareness is always the first step in anything, in healing and change. And you all are perfectly positioned to transform your cultures. When we're all 120 years old looking over our lives, what really matters is not how much money we made and how much power and what our titles were, what difference we made in the world. I know that's why you're all here. And that's why I'm here. And so I can't tell you what you should be doing to do that, but if you just raise the question, you'll know, because you know better than anyone what's possible within your culture. And again, I salute you for being here and for what you're doing, and I love my friend Mats and for the chance to be here today. So thanks for being here.
Thank you.